Hey guys, it's Shayna with Dr. Downs. Say hi, Dr. Downs. And we're here today talking about breast augmentation, one of our #1 surgeries at the Center PC on Douglas Road in Mishawaka. So Dr. Downs, how long have you been doing surgery?
Way too long. No, we've been doing this since 1992, so 27 years we've been at this. So we've seen the evolution, if you will, of breast augmentation through the old saline implants, through the new silicone gel breast implants. So there's a lot of questions, excuse me, when it comes down to breast augmentation in terms of implants. Because when we talk about breast augmentation, the two major things we talk about are safety of breast implants, what that entails, what are the dangers involved with breast implants, if any, what are the long-term consequences of having breast implants, and then what could you reasonably expect to look like if you have breast implants. And that's the big thing as well, because everybody comes in with different expectations. Some people like the natural look, some people like an unnatural look. It's really, everybody's different. And so we usually will talk to you about both of those aspects in the course of an examination. So if you look over here, you'll see we have a little bit of an array of implants, and these are silicone gel breast implants. They are very safe. They are these, a lot of people call them the gummy bear implant. Actually, I'm not sure that's a correct way of saying it, but that's at least very descriptive. So you can cut these implants in half, you can stick them with a pin, nothing leaks out. So they don't leak in the strict sense of the word, but they, if there's a damage or something to the implant, which is very rare, they would need to be replaced. So whenever we put implants in, we will tell you that they may or may not be permanent. So these are real soft, they're real natural feeling, and you can't be allergic to them, you can't reject them, they don't wear out, they don't biodegrade, but they are man-made. So these are what we would call a standard type of silicone gel breast implant. I use mostly implants from the Mentor Corporation, which has been making breast implants since the beginning. These are the new breast implants out there. They're called Mentor Extra. Same gel, same envelope, a little bit of extra gel in there, and as you'll notice if you look very carefully at these two, when this sits flat, you have a little bit of indentation or depression there. These do not do that. Now, these don't do that in the body. They don't look like that when they're in there because they're in an envelope and they do that. But these are just a little firmer, very, just as an option for you as you look at these implants. So these implants I typically will put in under the gland. Now, anybody out there that has friends that may not had breast augmentation, you're going to have a discussion, and you'll see even if you get online, under the muscle, over the muscle, which is best. Well, the old saline implants that we used to use would be put under the muscle almost exclusively because they were essentially a bag of water and didn't look good anywhere else. These, however, don't look like that. They look very natural in place. There's really no reason to put those under the muscle.
Okay, we have a question. When would you use a shaped implant?
Well, the shaped implants are very good, and a lot of times if you don't have any shape to your breast whatsoever to start out with, we would use what we call a shaped implant, which looks something like that. Now, you'll notice that this shaped implant is not round. It's more oval, and it is shaped. It's teardrop shaped. Now, I would also compare this to one of these implants, which upright is also teardrop shaped. I very rarely use these for breast augmentation. I use those more for breast reconstruction purposes because breast reconstruction patients need that shape, whereas if you are going in for breast augmentation, you already have a shape, you just need to augment that shape. I don't like these. If they turn a little bit, they look kind of silly. They're also textured. One of the things I get away from a lot now is textured implants because there's some indications out that there is an illness called breast implant associated anaplastic large cell lymphoma. This is a thing that has hit the press and has hit the media fairly recently. It is cancer. It's not breast cancer. It's a non-Hodgkin's type lymphoma that has been associated with textured breast implants. Now, there's two main companies in the United States that make textured breast implants. Mentor is one of them. Then there's several others. This has never been found in a Mentor breast implant. And it has a lot to do with the way these implants are textured. But suffice it to say, this is something that's come on over the past several years that we have become very aware of. The incidence of this is extremely, extremely low. But, and it is curable because once found, it is completely cured by removal of the implant, removal of the capsule. But we don't want to deal with that either way. It has never been found in a smooth implant. So when we talk about shaped implants, they're all textured. And they're all textured because they don't want to move. You can't have them move or they look terrible. So I very rarely use these anymore at all. So I usually will stick with a silicone gel smooth round implant. If these round implants rotate, they're still round.
So these implants are not associated with...
No, not at all. These are smooth implants and are not associated with that ALCL issue. And when you come in for a consult, we give you paperwork for that. It's just something you need to be aware of. So during the consult, you'll notice that all these implants here look a little bit different. They are all the same size. This is all. So when you come in, you look at a volume, say, okay, I like 350 cc implant. Well, that could look completely different on you depending on which one of these we put in. So how do we decide that? Well, a lot of it comes down to how you want to look or what your dimensions are, if you will. So in olden days, we used to pull out the old tape measure and measure you, and then we'd have you bring in pictures off of the internet to help us see what you want to do and what you want to look like. And that was kind of inaccurate. So now we're using three-dimensional imaging, which really helps us a lot. And as you can see on here, the computer can actually take a three-dimensional picture of you. We can look at you in different angles, all kinds of different angles, to get an idea of what you look like, what your dimensions are, and it does our assessment for us, so we can see on you what your symmetry is, what your base width is. This is the real important, this is the important measurement right here, because you don't want an implant that's too wide, it wraps halfway around your chest, or you don't want one that's too narrow. So you want one that's going to fit your breast. And that is why we have those different profiles. So we can look at all kinds of different measurements on you depending upon what we want to see. Sometimes people have an uneven rib cage, makes their breast look uneven, so we can even look at that with this technology, unless it screws up on me. So we do all those, and then we can come back and we have all our implants loaded in this computer. So based on those projections, we can pick an implant out based on your base width, and you can see the computer kind of gives us an idea. That doesn't mean we have to stick to that, but it gives us an idea of what range of implants works for your particular body build. And then what we can do is put that implant on you and get an idea of what it might look like. And you can say, ooh, that looks too big, that looks too small. We can look before and after. We can look at this, which is kind of cool, and show you what an implant would do volume and shape-wise to your breast. We can look at it with a bra or bathing suit on. So there's a number of different ways that we can evaluate your desire or get a better idea. And you can say to us, you know, I want to be bigger than that, or I don't like that. We can print this out. You go home with it. So it gives us an idea of how to proceed for you with regard to your breast augmentation. So this has been really successful. Now, this is not Photoshop where we just, you know, okay, we can make you look like anything. It's not a filter. What we are able to do is actually give you not 100% actual, but a close realization of what you might look like with certain breasts. So that's part of the other half of that equation, where we talk about what could you reasonably expect to look like with certain implants.
So we have a couple questions,
Yeah.
Dr. Downs. All right, so I'm going back to you. Is there any way to guarantee no loss of nipple sensation after breast augmentation?
No, we can't guarantee anything. Well, anytime you come into surgery, there's never a guarantee. I will tell you this: loss of nipple sensation is rare, and a lot of it has to do with the size increase. If you have really tiny breasts and we put in a really, really large implant, that doesn't mean you're going to have loss of nipple sensation. It just increases your likelihood, because we're stretching all that skin out, and that skin and that tissue contains nerves that supply the nipple. So the more we stretch that, the higher that likelihood. But then, and again, it's not you. It's the percentage of it being permanent is less than 0.5%. It's so small, but we can never guarantee 100% that you would not lose nipple sensation. And that dovetails into what we also will tell you when you come in for augmentation, is that we can't guarantee that somewhere in your lifetime you won't have to replace your breast implants. It's possible. I don't know. There could be a number of different reasons. You could have a problem with the implant. It could be several pregnancies afterwards. It could be just age. It could be anything. So the likelihood of requiring these to be replaced because they failed is very low, but that is not a guarantee that you won't need to have them replaced. The other thing we tell you is that if you're of childbearing age, it may inhibit your ability to breastfeed. Now, many women with implants can easily breastfeed, but we're obliged to tell you if we're going to manipulate the breast tissue, you might not be able to. I'm not sure that the percentage of women that have breast implants that can't breastfeed is any different than the general population that can't breastfeed to begin with, but we're operating on your breast, so you have to be aware of that. The other issue that people worry about is scarring. So when we put an implant in, the incision is under the breast. It's about this long, and it's very, very hard to see once it fades. But like all scars, it's red early on, and it's difficult. And you can see it, but it does fade. But it's very cosmetically innocuous. So.
Okay, we have a couple more questions here. What is the likelihood of your body to reject an implant?
Can't reject them. They are inert, which means that they don't stimulate an allergic response in your body.
Perfect. Another one is, how do you know the difference between needing an augmentation and a lift?
Okay, that's a great question. So when we look at these images and we turn it to the side, you'll notice that here's her inframammary fold, here's where the nipple is, so it's well above the inframammary fold. So droopiness for us is where your nipple is compared to that. So your nipple should be about an inch or two at least above your inframammary fold. If it's below that but not below the fold, it's what we call a grade 2 ptosis or droopiness. Grade 3 ptosis is a nipple that's below the crease. So when your nipple is below the crease of your breast, you're going to probably need some sort of lift. Typically when it's below the crease, you'll need what we call a standard lift, which would be an upside down T or anchor-shaped scar. If it's just a little low, but not below the crease, sometimes we can get away with a smaller lift, maybe just around the nipple, or what we call a circumvertical, where it goes around the nipple and down. But when it's up like this particular patient, then you don't need a lift at all. So that's how we determine that.
Perfect.
Yeah. So, and you can do your augmentation with the lift at the same time. The only time it's not recommended to do those at the same time is if you're a bariatric patient or you've lost just a ton of weight and the breast is deflated and you need the lift. Sometimes it's better to do the lift, let everything heal, and come back and do the implant.
Another question is, how long is the surgery and recovery?
Okay, so a standard augmentation takes me just under an hour to do. Because we're over the muscle, it really shortens your recovery time. In olden days, if you put the implant under the muscle, patients would describe the sensation as an elephant sitting on their chest. This is nothing like that. Many of my patients get by with just Advil and ice packs the day after. I think that for most patients, the average recovery time is just a couple of days, certainly less than a week. Resumption of exercising, aerobics, strenuous exercise, somewhere between 3 and 4 weeks, depending upon your healing and swelling.
Okay. Are your chances of infection after surgery higher if you have had issues with, is it mastitis in the past?
If your mastitis is not active, it shouldn't be a problem. That mastitis usually occurs within the ductal tissue of your breast. We're not getting into your ductal tissue, we're actually behind it. So we're actually elevating the breast tissue up off the muscle. So we're not actually getting into the breast tissue itself. So that shouldn't be an issue if your mastitis is not active. We wouldn't do implant surgery of any kind if you have any kind of active infection going on in your body.
Do you need to change your implants after every few years?
No. So that's an old wives' tale. Everybody thinks that they have to have their implants replaced every 10 years. That's a myth. So what happens is the old saline implants had a valve. You would fill them. You'd put them in empty. You could roll them up like a little taco.
Have one in here.
No, I got rid of it.
first.
Yeah, it was here for historical purposes. But they have a little valve, and that valve could become incompetent and leak and whatnot. So they looked at all women with saline implants, and the average replacement time was somewhere around 10 to 12 years for everything, not just leakage. But most of it was leakage. These are not like that. So you might have to replace them, but you could have these things for 30 years and never have a problem. So there's no law that says you have to have these replaced, only if you're having a problem. One of the things is a capsule. I mean, we didn't talk about that, but your body's going to form, when you put these in, your body forms a little layer of scar tissue around it. Does that around anything we implant in the body, whether it's an implant, a pacemaker. Our job is to keep that real thin and pliable so your breast is real natural feeling. Anything that's in there that will interrupt that scar tissue, like bacteria, blood, anything, can make it thicken, and when it thickens, it squeezes and it gets hard, and that's called a capsular contracture. The nice part about these implants is the capsular contracture rate is very, very, very low. As a matter of fact, the warranty for these implants also encompasses capsular contracture as well as seroma formation, which is a liquid or a serum collection that might occur over time. It's very rare, but they cover it. So we try to cover everything that might happen.
Someone just asked, and I think Ariel kind of came along a little later, are these smooth implants? And she wants to know what the textured implant looks like again. Can we go over that real quick?
Yeah, this is the ones you're looking at here are smooth. That's what a texturing would look like. I don't use these for a number of different reasons, but the number one reason now is it's got a very, very slight association with an illness called breast implant associated anaplastic large cell lymphoma. That's a mouthful. It's a non-Hodgkin's type of lymphoma, which is considered a cancer, that is isolated to the capsule, and they think it has something to do with the texturing. We're really working hard on that. The incidence is, the incidence is extremely low. It's different around the world, actually, interestingly enough, but in the United States, it's extremely low. They have had 5 or 6 fatalities from that, but that was a long time ago before we actually knew what it was. We do know what it is now. It's heralded by a late-forming seroma, which we test. If it's there, it's cured by removing the implant in the capsule. So that's what a texturing looks like. Texturing is used to kind of hold the implant in place. That's important when you look at these shaped implants because they're not round. So if they rotate, it looks really strange. These are round implants. If they rotate, they're round.
So we only use smooth implants for breast augmentation and lifts.
Yes.
Okay, I have a couple questions are coming in like crazy.
Uh-oh.
We'll do lightning round.
A lightning round. Go.
Okay. See, Paula has Graves' disease and my weight fluctuates. Would implants be a good idea? I have a lot of room.
Depends on how much you fluctuate. I think that weight stability is important no matter what we do, whether it's breast augmentation, liposuction, you name it. Stable weight is real, real important. I mean, if you have something cosmetically done to improve the contour of your body and then you gain 50 pounds or lose 50 pounds, it's not going to look good. So stability of weight is important. Now, everybody's weight fluctuates a little bit. 10% up, down during the year. That's not going to hurt anything, but large weight fluctuations will. If you have Graves' disease, you might have a little bit of trouble controlling weight in terms of weight loss. And so the first thing you have to do is get your Graves' disease under control. And if it's under control, your weight should stabilize and there should be no problem having breast implants. But with Graves' disease, it is just the weight fluctuations that you have to watch.
Okay, let's see. Love mine. Thank you, Dr. Downs. Do you use Sientra implants? Those seem to be popular.
They're not that popular, and no, I don't use them. I've used Mentor for 27 years, and I'm happy with them. I know what they do. I know what they look like. I do not use Sientra implants. Some of these Sientra implants, well, I'm not even going to talk about Sientra implants because I don't have any experience with them.
Okay. And Mentor is made in the USA too, right?
Mentor, actually, that's a very good point because Mentor is the only company that manufactures their implants in the United States. They're manufactured in Dallas, Texas.
That's correct. All right, here we go. Hey, Dr. Downs, I'll see you at my appointment later.
Today?
Yep, it's Kelly.
Cool. All right.
See you, Kelly.
I don't have to do your appointment now. I just did it.
No. Can you laser around incisions right after surgery to help with scarring?
Yeah, you have to wait a couple weeks to start that. When you come in, we talk to you about how to manage the scars. We actually give you some scar strips to manage it. Lasers are good, but they're expensive. I mean, they're involved. There's a price involved with getting scars lasered. We've also started doing some microneedling and PRP, platelet-rich plasma, for scars. That's excellent. But I'll be honest with you, the scar from the breast augmentation incision is so good. I mean, you're welcome to do that if you want to accelerate the maturation process. But these really are that long. They don't. I mean, you're welcome to spend extra money to help them, but I'm not sure you have to.
Yes. Love my doctor. Best guy that did my breast reduction.
We're talking reduction now. We can
Yeah. So that was the next question, and she says, "How do I know I need a reduction versus an aug?" Well, I think you.
Well, wait a minute. I think you'd know that. One's too big. One's not big enough. I think the other side of that question would be, how do I know if I need a breast reduction or just a lift?
Yes.
Okay. So 50% of
I have a hair in my eye. Hold on.
we're holding on. Shannon's got a hair in her eye. 50% of the problem with breast that cause you symptoms are size. The other 50% is location. So I tell my patients, if you take little 1-pound dumbbells, which don't weigh a whole lot, you put a twine together and you put them around your neck, and you hold them down here. They're down here. They don't feel like much for a couple weeks, but you go around about a month, they feel like they're 100 pounds. Put them up here, it's a whole different story. So we would evaluate you in terms of volume, because if you're, most of the time you mostly need a lift rather than a reduction. So that's really an individual issue, but we would have to look at you to decide that.
Someone wants to know, can any of these procedures go through insurance?
Any of what procedures? An augmentation? No, there's no way. That they don't. It's a cosmetic procedure.
Rats.
They will not pay for it. Yeah. Well, sorry. We do it here. We have a full OR here at the center, and it's state licensed and it's fully certified, and it's here in our practice. It's in the back part of our office. It's completely separate, but it's nice, very private. Answering a previous question, like what's the recovery time, what's the whole thing, it takes me about an hour, just under an hour, to do a breast augmentation. You come in about an hour ahead of time, get you ready, get you marked up, we do it, you're here about half an hour to an hour afterwards, and you go home. There's no drains, you're right in a bra, you can shower the next day.
Okay, 2 questions. One wants to know, is the OR private? Great question. Like, is it private?
We do not have grandstands in the operating room. There's no windows, there's no nobody can see in, passers-by. It's not like, yeah, it's perfectly private. We own it. There's a separate little nice waiting area, a separate entrance. It's all covered, separate parking. So everything is completely separate. In other words, you're not walking in through a room full of people in the waiting area. It's very private, yes.
Okay, a couple more. We know one on Instagram. I'm looking for my breast aug with Dr. Viscardi.
Nice.
In 1 month.
He's a good guy.
I'm really nervous. Any thoughts on education I should know?
Well, I think you should be careful to, a lot of people want to get online and look up all different sites and things like that to get ready for an appointment. And that's fine. I don't think that there's any problem with that. You just have to be very careful where you're looking. So there's a lot of information that you will get that is right, and there's some that's wrong. I would guide you to a couple different websites. One is ours. Center PC's website is chock full of information about breast augmentation, and it's all factual. It's all, that's a good resource. The American Society of Plastic Surgeons has a great website. That's a very good one. The American Society of Aesthetic Plastic Surgeons. These are all very, very good websites with information that you can depend on to be factual. It's not anecdotal. It's not getting on a group chat with a bunch of other people that have had breast augmentation or bad experiences. Just think about this for yourself. And the other thing you have to do is when you come in, remember you're coming in and you're doing this for yourself. You're not doing it for anybody else. You're not doing it for your significant other. You're just doing it for yourself. And if you're doing it for any other reason, you shouldn't do it.
And for those who don't know, Dr. Viscardi is Dr. Downs' partner.
Yes, Dr. Viscardi is my partner. He's very, very good. He's better looking than I am, so.
All right, a couple more. Will large implants cause back problems?
No. Interesting though, the one question we get is, are these heavier than breasts? No, they're not. Actually, the specific gravity, which is the density measurement of gel, is lower than it is for breast tissue. So if you had this implant and an equal amount of breast tissue here, the breast tissue would weigh more than the implant does. And again, we go back to that positioning point, because these are going to be up where they belong. So they should not cause back problems at all. Now, if they end up way down low, then they would cause you back problems, but implants won't move.
Okay, Jennifer wants to know, so do over the muscles still sag with age?
The implant's not going to move, whether it's under or over the muscle. Actually, the implants that are under the muscle move more because they have that constant push from the muscle. So the implants on top of the muscle they won't sag at all. Your breast might sag, but the implant's not going to sag.
Okay, it says, oh, your team has been excellent so far. Thank you.
So far, that means you have room to screw it up.
She says to give us all raises. It's just here.
Who is that? You? That's not even a real thing. Nobody said that. Nobody said that. Nice try, Shayna.
Do piercings have to be removed for an augmentation?
It helps because we use electrocautery during the procedure. So if you have like stainless steel or metal nipple rings or anything like that, or even earrings or anything like that, we like you either to leave them out, and if they're in a location where you can't remove them, at least replace them with plastic. Because there's all kinds of piercings. The only things that can't really be removed are those body piercing things that go in. They're all kind of permanent. And there's always a chance that it could cause a little burn in the skin. We tape it. We try to avoid that, and we haven't had one since or yet. But it can happen. So yeah.
Knock on that a couple times.
Yeah. Okay.
All right. Any other questions? I think we're getting to the end of the questions. I feel like we've had quite a few.
I know. That was good. Of course, we touched on some important points here. We actually, you'll hear some of the same things if you come in for a breast augmentation consult. We do. I mean, obviously, it's personalized to you, what you look like, and we would use your photo up here to make sure that we give you more personal appearance. So they typically last about 20 to 30 minutes. It might be a little bit longer because we get photo. We have to image you and do all that stuff, and you're going to have to get your quotes in terms of cost and all that stuff. So it might take you a little longer, but I spend some time with you. We go over all these issues with you. And then once you book your surgery, we have another consult. It's called our Informing Consent Consult. It's a very, very comprehensive packet of information we go through with you. And that's when we actually we zero in on what you really want to look like, remembering that the number one complaint for breast augmentation is I should have gone a size larger than I thought, because most women are very worried about looking too large, and so they subconsciously back down their expectations. So 2 main points: be realistic with yourself about what you want to look like, and don't think of yourself in terms of a bra size, because that's the other thing. Well, I want to be a C cup, I'm an A cup. Well, I don't know what a C cup looks like, and depending on where you buy your bra, you could be a B, C, or a D. Heck, if you go to Victoria's Secret, you're going to be a double D. So I don't know. But forget bra sizes. Go with how you want to look.
Is there a pricing for breast augmentation? And then also, good questions. Okay, we have a couple more. Is there pricing for breast augmentation? What is it? Is there pricing for if you switch them out and a minor 10 years old, should they be replaced? And also, I missed the beginning, but this is a couple I'm linking them. Is the consultation free?
Consultation is free. Switching them out depends. The cost of that's really going to depend on what we have to do. So if you're just going from saline to silicone, that's one thing. If we're going from over the muscle, that's a different thing. If you have a capsule problem, that's an issue. If we have to do a lift along with it, so those prices are harder to pin down. If you're coming in and you're going for a straight out augmentation, the only thing that's going to vary in terms of the pricing is going to be which implants you want to use, because these are a little bit more expensive. But typically, the range is somewhere between $5,500 and $6,000. They don't let me talk money. So
$5,900 is starting for breast augmentation.
there you go. There it is. Boom. And I was just trying to be vague. She was very specific.
It's a starting, yep.
So
I think to be exact, it's $5,915.
if you bring your own implants, it's cheaper. You can't bring your own implants. I was joking. It's a joke.
Is consultation free?
Yes, I answered that. Yes.
Oh, sorry, missed it. What is the largest CC you will do?
The largest CCs we can do is 800. We used to have one.
Yeah, it's up there.
Is that 800 or that? No.
That looks really big.
That's it.
Might be it.
That's an Athena one. Isn't it? No.
Here, put it down.
I don't know if that is. They're big though. I can't read that. What's it say, Shane?
Well, you gotta flip it over, I think.
I can't read it on my glasses.
Hold on. Well, I gotta have these two phones on.
It's written in there.
Hold on, I gotta flip it. Sorry, guys.
Technical
Did
difficulty.
anybody see it? Oh, 800.
Yeah, so that's an 800. That's the biggest implant you can get. Now, there are some people on there that won't look so big. But if you get some people that would look gigantic. This is a 350. And that might look big on certain people. It might look not big. So it really depends on how you're built. So but that's the biggest one they make. So when you see these people online, they have 3,000 cc implants. That's not gel implants. Those are saline implants that somebody has overinflated, which is not recommended. And those people are not probably, I won't say it, but they're probably not somebody you should seek out.
Correct. Any other questions before we say goodbye? I'm sure there's some appointments that are coming today that have come.
Yeah, we're going to do it today. I mean, I think what you want to do is searching out your plastic surgeon to make sure that a couple things are in line for you. One, make sure that your plastic surgeon is board certified. Okay, that is extremely important. Plastic surgeons are trained to do this. Other doctors are not trained to do this. So if another doctor is doing this other than a plastic surgeon, they've been trained in a weekend course or somewhere else for the most part. So you want to be very careful about who you choose to do your breast augmentation, whether it's here or anywhere else in the country. You want to make sure that the surgeon you're going to has a pretty good experience with these things. And ask him, how many, do you get complications with these? Well, sure, there are complications. They're minimal, but there are there, and how do you take care of them? If someone tells you they haven't had a complication, one of two things is occurring. They're either lying to you or they don't do surgery. So those exist. Two, you want to be careful where you're coming. I mean, obviously we're here at the Center PC. We're on Douglas Road in Mishawaka. There are people out there that are, they would like to be us. Or they would like to do this, and you want to be careful. And when you're coming to the Center PC, come to the Center PC.
That's right.
CENTRE.
The British way.
We spell it the British way.
Because we're
special.
We're special.
We're special flowers here.
I'm extremely happy with my results, Dr. Downs. You're my hero. Look at that. Hi, Jennifer.
We'll have to.
I know, you need a medal. Oh, geez. Okay. Oh, my goodness. Oh, my gosh. Okay, what percent of patients have issues after surgery?
Complication rates are real low. The two main complications you worry about are hematoma, which is a blood collection that can occur in the pocket. It's not life-threatening. We're not bleeding to death, but we don't want any blood around that implant because it can cause scar tissue. That is less than 1%. And infection rate, we give you prophylactic antibiotics before and after. The infection rate's less than 0.1%. Rippling, very, very rare, less than 0.1% with these implants. More common in somebody who has a very, very, very low body fat percentage. That's about it. I mean, they're all different, but it's an extremely low complication rate. But it's not zero. It's not zero. So
And I think that one thing I want to point out too, because I work on this side of the practice, is we do have a lot of testing. Sometimes we make you go through prior to surgery, and I think that's important.
Well, that's true. So if you have pre-existing conditions, that doesn't preclude you from having this. But remember, we're going to be safe about it. So if you come in with high blood pressure, we're going to make sure that it's controlled. We're going to make sure that you have an electrocardiogram before your surgery. If you are diabetic, that doesn't preclude you from having a breast augmentation.
Smoking.
But we're going to talk to you about your hemoglobin A1C. We're going to make sure your blood sugar, because we're a medical practice, we want to make sure you're healthy and safe as it can be. Smoking, you're going to hear it from us all the time. There are a lot of procedures we won't do if you're smoking. You have to be smoke-free for about 4 weeks. Luckily, breast augmentation we will do in smokers. But you've got to remember, if you are actively smoking, and it's not the smoking, it's the nicotine, you're putting yourself at a much, much higher risk for complications from healing. So it's nicotine products, so gum, patches, all that stuff have to be stopped about 4 weeks prior.
Okay, 2 more questions. Is there a maximum amount that you can take out of reduction, like 2 cups or maximum of 3 cup sizes?
No, there's no maximum. The goal behind reduction is to leave enough behind so the nipple has blood supply.
Okay. Can you fill a current implant to make it larger?
Only if it's saline.
Okay, so you can fill saline?
Yeah, you can't. With
To make it bigger?
Gel, you can't. Saline has that valve we discussed
Right.
earlier.
Okay.
It's hard though if you've already had them in for a while because that scar tissue is formed. So stretching them out may make them firm.
Oh, SpaghettiOs. Might want to just exchange them out then.
Silicone gel are much nicer than the saline.
How long does silicone gel usually last?
They're warranted to last for life, so they last as long as you do. Now that's the warranty. They're man-made. There's always a possibility that something could happen where they could leak, but their leak rate is extremely low. There's no valve. There's nothing in there. They're made as one unit. So
And they're pretty durable, right? Like, can you throw
yeah,
one down?
I mean, if somebody's doing this to your breast, you're going to stop them long before they hurt your implant. The blunt force trauma required to burst your implant would kill you before it breaks your implant.
You know, I'm gonna be honest. We had an implant that kind of got like deformed, and so I tried to cut it. It was really hard. I had a hard time with my scissors trying to cut it.
We did have a patient bring in a youngster. I guess it was a toddler. That would be, was able to bite one, which was interesting. Didn't get through it, but got a good tooth mark in it.
Okay, for a lift and an augmentation, where do they put the implant?
Over the muscle. Absolutely.
Is the breast implant illness a real thing?
Yes.
Okay, and if so, what's the chances of it happening?
Well, we had a big discussion about this earlier.
Yeah,
so
if you go
it is a
earlier
real
in the
thing.
feed.
It's breast implant associated anaplastic large cell lymphoma. It's with textured implants only. And it has a very, very low incidence. It's less than 1 in 30,000. However, it is a thing. But we know about it. We're aware of it. We know how it presents, and it's curable.
Someone says, can you show me a 340cc?
No.
Yes.
That's a 350. That's
This
a
is
350.
so that's pretty close.
There is no 340.
However, we can actually come in, Maria, and if you go earlier in the after live, you can actually see that we can actually put a 350 on your body, like the image.
Yeah, I can do it. Like we'd image you here. That's a 425, for instance, on this person. And we can do that with 350s or any size you want.
Cool. All right. Well, I think we need to wrap this up. We had a lot of questions today, Dr. Jones. You're popular.
I think that it's a good subject. I think a lot of people. It's the #1 most performed cosmetic surgery across the country. So, there's a lot of people thinking about doing it. There's a lot of people that have done it. So it's always a source of questions and interest because it's very popular surgery.
Erica, are you talking about me or Dr. Downs?
Uh-oh.
She says, lovely that you said yes. Very honest and appreciate the truth.
Well, it's true. I mean, you can Google it. I mean, it's there. If you want to learn more about breast implant associated ALCL, we have information here at the center, Center PC, or we also have. You can link to our website, or also American Society of Plastic Surgeons has a nice. And also, the FDA has a. If you get on the FDA website, they can talk to you about it as well. And understand that the FDA is very aware of this, and they're not even thinking about pulling implants off the market or anything like that. It's.
And again, it's only in textured, and we use smooth for augmentation. So if you're having an augmentation, it will not affect you.
Right.
Last one are implants. Oh, is there implants? Oh, Erica, come on, don't say the doctor, say Shayna. Are the implants? Is there wider implants? Basically, what's wrong? So we'll
Yeah, I mean, these are all the same. These are all the same size. So this is a narrower, higher implant, wider, flatter implant. Really, which one you use depends on what you're trying to achieve, and what your body measurements are.
I'm on both Facebook pages to see both sides of the issue.
Which Facebook pages? There's 2. We have 2.
I don't know. Maybe she means she's on Instagram.
Got it.
Because
Okay.
I'm feeding from both right now.
Good.
All right. Is that all you got for today?
Any more questions? Come on in. See us.
Yeah. Okay, I'm going to go ahead and stop the Instagram feed. Bye, Instagram. Say bye, Dr. Downs.
Bye, Dr. Downs.
All right. All right, you guys. So I'm going to flip the camera to me. My hair's a little wild today.
It was in your eye.
I know. It was in my eye. And Dr. Downs, I did my breast reduction in Og. Very happy. Would recommend him. There you go. Another one for today.
Keep those nice comments coming. We appreciate it. Hey, if you really, no, seriously, if you guys, everybody is like a creature of social media these days. So if you have nice things to say about us, get on our social media and give us a nice review. That's always helpful.
It really is. He's so funny. Love him. What about me, Jennifer? I want some love. Nobody loves me today.
Everybody loves Shayna. Everybody loves you.
Jeez. Mr. Popular over here.
Yeah, sure.
All right, you guys. So it's me. A little wild hair today. But again, if you're interested in having a breast augmentation, a lift, or even a reduction with Dr. Downs or Dr. Viscardi, you can give us a call at 574-968-9100, and we are the Center PC on Douglas. Option 1, I think.
Option 1. There you go.
Option 1. We are the Center PC on Douglas Road, and the only Center PC. And also, kind of a cool big announcement if you guys are watching the Grammys on Sunday. Right after the Grammys, you will see an exclusive interview with Dr. Downs in Teens and Filters on WSBT. So make sure you tune into us on Sunday. We're still getting lots of great doctor. Worked with him 12 years ago. Oh, Jennifer does love me too. Thanks, Jennifer. I'm a pro implant, non-implant pages. Oh, see both before deciding. Good idea. Do your research. Make sure you're going to the right sources. Again, and we'll be back next Friday at noon. I think we're going to head back to the med spa next Friday with to see those lovely ladies. So if you guys have any questions, you can message us through our Facebook page. I will try to answer them as much as I can. And we hope you guys have a great weekend. See you guys later. Say bye, Dr. Downs.
Bye, Dr. Downs.